tell us what healthexpense.com does.
Yeah, so Health Expense is really helping individual patients manage their healthcare costs. What we do is provide a platform where patients, you and I as individuals, can actually easily pay their healthcare bills, schedule care with their doctor, get better access to healthcare, and we solve the problem that people have with healthcare costs going through the roof nowadays, and really helping people manage those costs better, find ways to reduce it.
I see. So are you guys a B2C company or a B2B company?
No, we're actually entirely a business-to-business company.
Okay.
What we found was that there's lots of companies like banks, which provide health savings account, insurance companies who really in the past have not really served their customer well. So what we do for them is provide all of these tools that they can provide to their patients, their members, their consumers, and help them better connect and make those decisions that they should be making all along.
So it's ultimately a consumer-facing product,
Yes.
but your clients are whom?
Our clients are banks,
Okay.
insurance companies, very large administrators, and off late we're finding hospitals and large care health systems also wishing to engage with us and use these types of tools.
So what was your aha moment for this business?
I've been in healthcare for 20 years,
Okay.
actually worked at different facets of the industry, worked with the FDA, which actually regulates this industry, and when I first came into it, really the need was to help really individuals, patients who were dealing with the healthcare costs, help them solve that problem. The aha moment came literally a year later when we first started to find that it wasn't just the patient who had the problem, it's everybody around the patient. The doctors had the same problem. When the costs go up, they also suffer as well. So that was our shift, that was our aha moment to realize that we could serve both the enterprise and the patient as well at the same time.
I see. So, I mean, healthcare in general is really going through sort of a renaissance, a kind of a paradigm shift. How is it that you guys are revolutionizing or disrupting the industry?
Yeah, so what we see ourselves is really enabling the new shift that's happening in healthcare. I think everybody in the country understands the healthcare law. The real big impact of healthcare law is going to be to really change the way people buy insurance. As a result, they'll be able to free to make a lot of decisions about where they go for care, which doctor they see, what kind of insurance plan they help. So what we see ourselves is really helping that shift, accelerating that shift, enabling that shift to happen, so making individuals more in control of their healthcare. So we have this concept of owning your healthcare.
Right.
That's really what we are trying to do, is help you and I as individuals own their healthcare finally, when they never did that in the past.
Yeah, I'm a big fan of that. I'm seeing a lot of gamification, a lot of mobile apps that are really, empowering consumers to just take more proactivity with, preventative medicine and taking care of ourselves. I think it's a great movement.
Yeah, and that's really what we see. We actually have a mobile application, both iPhone and Android.
Okay.
And really, helping the individual patient with, which doctor is best for them, when to go for care, what kind of bills do I have, and if you've ever been with kids and in healthcare situations, and you start getting all these claims, that's really when we come in the forefront, and we're really where we can help as a technology.
That makes sense. So we have a lot of small businesses, a lot of entrepreneurs, here at TiEcon 2013. What advice can you give us to start our businesses?
I think persistence as a business. We took our own sweet time getting to a point where today we actually won the TI 50 award. We see that as a step in just the growth and maturity of the business.
Don't give up.
Yeah, don't give up. I think that's the only thing I can say that helped us all along.
I think that's golden advice.
Yeah.
Yes. Well, thank you so much for your time. Really appreciate it.
Thanks. Pleasure to be here.